Okay, so we will be looking at the brachial plexus, anatomy of brachial plexus, and some very important things and the commonly repeatedly asked questions. So in brachial plexus, there are roots like C5, C6, C7, C8, and T1, and there are trunks: upper trunk, middle trunk, and lower trunk. Then comes division, that is anterior division and posterior division, and then finally comes codes, that are different codes like lateral code, posterior code, and medial code. Now, what happens that the different nerves arises from different parts of brachial plexus, like axillary nerve arises from posterior cord, and musculocutaneous nerve arises from lateral cord, while ulnar nerve arises from, here you can see, ulnar nerve arises from posterior medial cord, and then musculocutaneous nerve arises from medial cord, and then there is suprascapular nerve that arises from upper trunk. So in this way, yeah, superior trunk. In this way, brachial nerve gives off different nerves. So you have to keep in the mind an anatomy of brachial plexus and some clinical important points related to brachial plexus are: upper trunk lesion results into herb palsy, that is C5 to C6 paralysis, and that is birth injury or fall on the shoulder injury, arms hang by the side, and it is known as waiter step. While lower trunk lesion results into clumsy palsy, excessive abduction of arm or claw hand, plus which is due to ulnar and medial nerve involvement. Then comes long thoracic nerve due to winging, and there is a presentation like winging of scapula, which is caused by serratus anterior and paralysis. And then comes axillary nerve, which causes deltoid paralysis and loss of shoulder abduction beyond 50 degree. So in this way, this is the different nerve lesion resulting different parts of the nerves. Okay, so as we can see from this image that ulnar nerve and medial nerve is supplying different parts of the hand. Like as we can see, the ulnar nerve is supplying this part of the hand and median nerve is supplying this part of the hand, while radial nerve is supplying innervating here. So ulnar nerve damage results in loss of sensation of last two fingers, while median nerve results into the damage of index finger. So whenever in the question it is asked, you have to answer accordingly. Now there is a question: a patient has injury in the axilla, can't extend his index finger, loss of sensation of dorsum of the thumb, and uh, index nerve damage is that is radial nerve. Like radial nerve supplies the, as we can see here in this image, radial nerve supplying thumb. Radial nerve is supplying thumb, and a patient has damage in axillary area. So in this way, you have to keep this thing in the mind, that what kind of nerve is innervating which part of the upper limb. So in this way, you can easily answer the question, and